Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A physical therapist works with a patient on proprioceptive imbalance activities due to a history of recent falls. The patient informs the therapist they have recently been diagnosed with optic neuritis. Which of the following medical conditions is most likely associated with the patient's diagnosis? Option 1, Parkinson's disease. Option 2, Guillain-Barre syndrome. Option 3, Myasthenia gravis. Option 4, multiple sclerosis. Optic neuritis refers to inflammation that damages the optic nerve, cranial nerve 2, which transmits afferent visual information from the eye to the brain. Because the optic nerve is an extension of the cerebral cortex, it's vulnerable to the effects of demyelination. Let's explore each of the options. Option 1, Parkinson's disease. Parkinson's disease is a progressive neurological disorder characterized by movement problems, including tremors, stiffness, and slowness of movement caused by a loss of nerve cells in the brain that produce dopamine. The early signs of Parkinson's disease include resting tremors, usually in the hands, for example, pill rolling tremor, or feet, that increase with stress and disappear with movement or rest. Although early symptoms can also include balance disturbances, optic neuritis is not associated with Parkinson's disease. Option 2, Guillain-Barre syndrome. Guillain-Barre syndrome, or acute polyneuropathy, is a temporary inflammation and demyelination of the peripheral nerve's myelin sheaths, potentially resulting in axonal degeneration. The early signs of Guillain-Barre syndrome include distal symmetrical motor weakness and mild distal sensory impairments. Complications most associated with Guillain-Barre syndrome include muscle and respiratory paralysis, dysphagia, bladder weakness, and autonomic nervous system involvement, including arrhythmia, tachycardia, postural hypotension, heart block, and absent reflexes. Optic neuritis is not associated with Guillain-Barre syndrome. Option 3, Myasthenia gravis. Myasthenia gravis is a chronic autoimmune disorder that affects the neuromuscular junction due to the body's immune system producing antibodies that block or destroy acetylcholine receptors. The primary feature of myasthenia gravis is muscle weakness within the skeletal muscles, with other neurologic findings being normal, for example, reflexes and sensation. Because the ocular muscles are commonly affected, the patient can experience diplopia and ptosis, that is to say, drooping eyelid. However, optic neuritis is not associated with myasthenia gravis. Option 4, multiple sclerosis. Multiple sclerosis produces patches of demyelination of the myelin sheaths that surround nerves within the brain and spinal cord. This decreases the efficiency of nerve impulse transmission. The initial symptoms of multiple sclerosis can include visual problems, sensory changes, clumsiness, weakness, ataxia, balance dysfunction, and fatigue. Optic neuritis is often one of the first clinical signs of MS, since MS is characterized by demyelination of the myelin sheaths that surround the nerves within the brain and spinal cord. A history of recent falls, proprioceptive imbalance impairments, and the presence of optic neuritis result in MS being the most realistic medical condition. The correct answer is option 4. Let's explore the all-student data. 4% of students selected option 1, Parkinson's disease. 9% of students selected option 2, Guillain-Barre syndrome. 22% of students selected option 3, Myasthenia gravis. 65% of students selected option 4, multiple sclerosis, the correct response. System classification. This question is a neuromuscular and nervous system question which represents approximately 24% of all exam items. Content outline classification. This question is a Foundations for Evaluation Differential Diagnosis and Prognosis question, which represents approximately 33% of all exam items. Level classification. This question is a Level 1 question since the question requires students to possess basic foundational academic knowledge. Remediation of Level 1 questions occurs through academic review of entry-level content using textbooks, review books, Basecamp, and flashcards. Thanks for joining us on the Score Builders question and answer video session. See you next week.